Providence Health Care has provided compassionate residential care for decades. However, aging infrastructure and homes that have evolved from a medical system have led to a focus on efficiency, rather than emotional connections and quality of life for residents. As a result, residents' days are primarily directed by what makes sense for the organization, system, and staff, rather than what residents want. Recognizing this, Providence's residential care program gathered information to find out more about the problem and dig deep into the resident experience. And Residential Care for Me was born.
Human-centered design is a process that we use that focuses on empathy and helps us really understand the experience of our residents, families, and staff. So what it's like to live here, work here, and visit. And that gave us a bunch of insights about how to make residential care a place that we would all want to live. Based on those insights, we actually take those ideas and have brainstorming sessions and then test out the ideas on a small scale at our homes.
It became clear to the Residential Care for Me team, led by Joanne Tate, that something creative was needed to shake loose the institutional routines developed over time that were acting as barriers to change. Introducing Megamorphosis, the next phase of Residential Care for Me.
So Megamorphosis is the deliberate approach to shift from a traditional institutional model into a social one.
Megamorphosis allows us to really try and test things, test them today or test them tomorrow. Often we might have had good ideas, but felt constrained by how we've always done it.
We started with some of the traditional methods like focus groups and interviews and surveys. We also did observations focusing on those people who don't necessarily have an advocate or who can speak for themselves. And so we tried to capture residents' voices from across the spectrum.
Spaces that once belonged to staff have been redesigned to be spaces for living. One small room used by staff was turned into a mahjong room. In another instance, residents helped paint the nursing station to make it look like a coffee shop. Residents and staff have also worked together to personalize their bedroom doors to tell a story about themselves. The efforts seem to be paying off. Observations using an emotional connectedness scale show that positive social interactions have increased significantly from just 1 year ago.
My team humbles me every single day. They are the most creative, bold, rule breakers that I have ever met, and I believe our success is because of how much they truly value quality of life for our residents and our staff.
For recognizing that people live and thrive and find happiness in homes and not institutions, and striving to provide a more social and human model of residential care, Providence Health Care is awarded the Dianna Mah-Jones Award of Excellence in Person-Centered Care.